Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
When making radiographic images of teeth, we desire that the images are the same shape and form as the tooth itself. We want the image to be sharp and distinct and be of natural or lifelike size. Now, there are many, many ways in which we can produce images which are distorted. And so the first form of distortion that I'll illustrate will be that of enlargement. Now we turn to the first chart. We have a source of radiation located here. We have an object shaped like a tooth, O units long, and then finally a film on which the image is cast. The image is I units long. Now, the image is larger than the object because the rays originated at the source, and one ray passed through the tip of the tooth, causing it to record up here. Another ray followed this path, causing the incisal edge to record over here. Now, the image is larger than the object by this amount. This is the object, and here is the amount where the image is in excess of the object. Now, this red triangle here enable us to arrive at a certain relationship which will express the percent of enlargement as being equal to 100 times the object film distance divided by the source object distance. Enlargement is not a desirable property. We wish to minimize it. We have two ways in which we can minimize enlargement. First, by making the numerator smaller, that is, bringing the object and the film closer together, or secondly, by increasing the distance between the source and the object. Increasing the denominator makes the fraction smaller. Diminishing the numerator makes the fraction smaller. Now we'll demonstrate this with shadow images of my hand. Here we see the source, the object, my hand, and the image. Now, my hand is of fairly normal size, but you notice the size of the image is gross. It is longer than normal. It is wider than normal. All dimensions have been magnified. So the size of the image on the screen is a variable depending upon where the hand and the source and the screen are located. To minimize enlargement, according to this previous relationship that we were looking at, said that if we have the object and the screen close together, that is one way of minimizing the size of the image. And there you see the image fits the hand like a glove. Now, how close one can put the film to the tooth, that is limited by the anatomy of the person. So when you run into the roof of the mouth, that's as close as you can get the film to the tooth. Now, the second way in which we can minimize enlargement is by increasing the distance between the source and the object. So now I'm stretching the light source as far as my arms will allow. Now that's as far as I can reach. That's an anatomical limit in my part. But in actual practice, how far away we remove the source is determined by the exposure time distance law. When the source is so far away from the film and the object, the exposure time gets excessively long, then the patient gets tired and wiggles. And then, of course, the picture is no good. Now, blurred images are certainly distorted images. So any way in which we can reduce the amount of blurring would be desirable. A property of images called definition relates to their sharpness, distinctness, or clarity of outline. Now we want to be able to measure this property of definition. So we turn to the chart and we'll formulate a way of making this measurement. We have a source, an object, and the film. This time the source has finite size to it, S units long. This distance would perhaps be 1 millimeter in an X-ray tube. This would be a normal sized tooth, and then the image is cast upon the film. The uppermost point of the source emits radiation which goes in all directions, but there's one ray which interests me, which is traveling along this path through the apex of the tooth and records here on the film. Now while that's happening, a ray which originated at the bottom of the source, following this lower path, also passes through the apex of the tooth and records on the film at this upper level. The spacing between these two is P units. P stands for penumbra. It seems that our final picture is formed by a multitude of shadow images, no two of which superimpose exactly. And it is this area where they do not superimpose that results in this fuzzy edging around each detail. Now, if we look carefully, we notice that we have similar triangles. The base of one is P units, and the height is object film distance. The second triangle has as its base S, and its height is source object distance. And so we could say the base of one is to the base of the other as the height of the first one was to the height of the second one. And that's this relationship that we have here. Now I have three terms upon which I can operate to make P, penumbra, small. For when penumbra is small, my images are sharp. I want to make the source small. I would like to make the object film distance small, and I would like to make the source object distance large. So now we'll darken the room and I'll demonstrate these three entities. Here we see the image of these two fingers, and I want to make the images just as sharp and clear as possible. Now the source should be small. Now you can't very well go to the dental dealer and say, I want to buy an X-ray tube with the teeny tiniest source. He'd laugh you out of the store because they all come about the same size. But the way in which you use the source of X-ray will influence the outcome of your image. The head of the X-ray machine is supported on a long extension arm, and it may wiggle. It may move up and down, or it may move sideways. Now you see from this demonstration that if the head of the machine is moving, the image is cast progressively on different areas of the film. All these positions are recorded, and so when you finally look at the image, you'll see all of these images and they will be blurred. So a motionless source is very important. Now the second thing, here we have just the outline of the ends of these two fingers, and you see there is lots of fuzzy gray edging around the internal portions. Now I'd like to diminish this fuzzy gray edging because that is a measure of unsharpness. Lots of penumbra is undesirable. So by making the numerator smaller, that is, decreasing the distance between the object and the screen, I make the image very sharp indeed. Now I'm touching the screen. That's as close as I can get the objects to the screen. When the film is touching the roof of the mouth, this is the anatomical limit on how close you can get the packet to the tooth. Now the other way in which we can sharpen up these images is to move the source back from the object. So here I'm moving it back. Now this is about as far as I can stretch my arms, and the images are very nice and sharp and distinct. So these were the three ways in which I minimize the blurring of my images. Shown here are two radiographs of the same tooth. The one on the right displays the tooth with the image grossly enlarged and exhibiting poor definition. It was made with the film remote from the tooth and the source quite close to the tooth. The one on the left shows the tooth in its normal size, and the details show with a minimum amount of penumbra. The image is very, very sharp. It was made by having the film close to the tooth and the source quite remote. With enlargement, both length and width were distorted. Now we will demonstrate only the length without the width. So only the vertical dimension is changed. I have a plywood model cut in the form of a maxillary central incisor. Now I have a white cardboard screen, and I'm going to fasten the tooth at an angle to the plane of the film. Now you can readily see the angle formed by the long axis of the tooth and the plane of the film. The incisal portion of the tooth is in contact with the screen. Now I'll take my light source and I will direct the rays downward and then in this other direction. Now we'll have to darken the room so that you can see the image. The image of the tooth seems to be about of correct length. Now I have made it too short by directing the rays downward, and when I direct the rays in a more upward direction, then the image gets very long. So by changing the direction of the rays, can I alter merely the length and not the width of the tooth? This applies only when the film and the tooth are at an angle to one another. Next, we'll go to a more complicated form of tooth, one which has two roots. Here we have a complicated tooth, namely a maxillary bicuspid. The two halves were cut on the bandsaw at the same time, and so they're of identical length and form. Now, by changing the direction of the beam, I can make the images long or short. But in addition to that, I can make one root longer than normal and the other one shorter than normal. There you see it. Now remember, they're both of the same length, yet the image of one is longer than life size and the other shorter than life size. This is what we call anatomical distortion. Shown here is a radiograph of some maxillary teeth. The film was positioned at an angle to the long axes of the teeth, and the rays were directed in such a manner that the length of the images has been greatly increased, so much so that the root apices extend off the top of the film. Therefore, we would have to redo this radiograph and alter the direction of the beam so as to shorten the images of the teeth. Here we have overcompensated for the extreme length shown in the previous radiograph. Here the images of the teeth appear very, very shortened, and the details of the bone lying above the roots of the teeth clearly shows. The width of the image has not been distorted, only the length, and this is an example of foreshortening. Shown here is the image of a maxillary first molar, and it has both a lingual root and buccal roots. The three roots are approximately of the same length, yet here we have caused anatomical distortion to occur. Here is the apex of the lingual root, and no longer do we see the buccal roots equaling it in length. They have recorded down at this height. They are shorter than normal. The lingual root is longer than normal. That is just a flaw inherent in this particular technique, where the film is at an angle to the long axis of the tooth. I have a yardstick to which I have fastened numerous popsicle sticks. Each of them is spaced 2 inches apart from the next one. I have a screen on which we will cast the image of these popsicle sticks, and we're going to make a mark with a felt pen wherever these shadow images hit. We'll do it first with the board held nice and straight as you see it now, and then we'll do that same process but with the board tilted like this, and we'll be able to see that we can introduce length distortion merely by bending the screen. So we'll put the board behind the object. And now we need the room darkened, please. Now quickly draw a horizontal line wherever you see a shadow of the popsicle stick. Now the board is held perfectly flat, parallel with the yardstick. Now next we will bend the screen, and now repeat again very good. Now we'll turn on the light and see what we have. When the screen was held flat and parallel to the yardstick, we were able to record the images of 9 of these popsicle sticks. The spacing between each pair of sticks was constant. However, when the screen was bent and we reproduced the images again, only 6 of the popsicle stick images recorded on the board, and the spacing turned out to be about the same at the beginning, but then as we entered into the bent portion of the board, the spacing became wider and still much wider. So when this occurs on a tooth, part of the tooth records properly, and then the rest of it gets stretched out exceedingly far. This radiograph was made by placing the film packet between the patient's tongue and teeth. Now, we are tender-hearted, and we couldn't get the film down as far as it must go without hurting the patient, and so we curved the film underneath the tongue. And you see the portion of the image of the roots has been stretched out and is utterly worthless. This is because this part of the image fell on a curved part of the screen or the film. The coronal part of the tooth is fine. It has reproduced normally, but here things are stretched out more and more and more. So the moral is the film must be kept flat when the image is cast upon it. We have illustrated how we can alter the length of the object, and now we'll alter its horizontal dimension, its width. Now to do that, we'll utilize this red box simulating the crown of a single tooth. And then we have a screen on which we will cast the image, and finally the source is off screen. Now we must darken the room to see the image. We see the image of this red box cast upon the screen. This represents the crown of 1 molar tooth. The width of the image corresponds to the width of the tooth. The rays are being directed parallel to the proximal surface of the tooth and perpendicular to the screen. Now I'm going to change the position of the screen, and as I do that, you notice that the image gets wider and wider and wider. Now the rays are not directed perpendicular to the screen. So this illustrates one type of width distortion. Now we'll bring it back to its proper relationship. A second type of width distortion is illustrated here. The left-hand edge of the image is caused by the left-hand front edge of this tooth. The right-hand edge of the image is caused by the front right edge of the tooth. Now, if we change the direction of the rays, you notice the image is getting wider. The left-hand edge is still caused by the left-hand edge of the tooth. However, the right-hand edge of the image is no longer being cast by the front right edge of the tooth. Instead, it is now being caused by the rear right edge of the tooth. We are not directing the rays parallel to the proximal surface in this instance. So merely by bringing the X-ray source back into position can we rectify that type of distortion. A third type of distortion is frequently present when we radiograph lower incisors. There, the film packet may be forced to assume the curve of the dental arch. Now we'll introduce a second tooth. There is an interproximal spacing between the teeth. Let's say these represent two anterior teeth. The film right now is perfectly flat, but now I'm going to bend it. It's going to assume this shape when the image is cast upon it. Now, would you please trace the outlines of the two shadows? And now to the other side, please. Now, to see the width distortion, we must turn on the room lights. The screen was curved like this while the images were cast upon it. Now, we normally don't view our radiographs while they're curved. Instead, we view them while they are simply a plane surface. And when viewed perpendicular to the flat surface of the radiograph, we see we have grossly widened the images of these two teeth. Now we understand how this occurs. Now on the next slide we will see the actual radiograph illustrating this phenomenon. This slide illustrates the type of distortion that we indicated with the curved film. The images of the two centrals have recorded with fairly normal width to them. However, the images of the laterals are extremely widened simply because the image was cast upon the rounded surface of the film. Now, the next slide will indicate one of the other types of distortion. This radiograph illustrates where we have widened the image of the tooth by maneuvering the position of the film so the rays were no longer striking it perpendicularly. The rays were directed parallel to the proximal surface. We've gotten through the contacts very nicely, but because the rays were not perpendicular to the film, we have this extreme width distortion. The remedy is simply to make sure the film is perpendicular to the direction of the rays. Another type of distortion is where the image is tilted. Now normally the image of a tooth does have a slight distal tilt to it. Now when we use the angular method of positioning the film in the mouth relative to the teeth, this tilting of the root is very easily accomplished. Now I'd like to demonstrate that with my light source, the tooth, and the film. Now we'll darken the room and I'll move the source. We have the image of the tooth positioned erect. Now when I direct the rays toward my right, the image slopes to my right. If I direct the rays toward my left, the image will slope to the left. All right, this tilting or sloping of the root is a phenomenon only associated with this angular method of positioning the film in the mouth. The root of the tooth is erect in the center illustration, and when the rays were directed to one side, the roots tilted in that direction, and when the rays were directed in the other direction, the roots tilted in that direction. So the horizontal angulation that is employed governs whether the tooth tilts or whether it records erect. Another form of distortion occurs when the images of two adjacent teeth are overlapped. Now, overlapping should be avoided when we're making our posterior bite wing radiographs, where we're looking for cavities occurring on the proximal surfaces of the teeth. Now I can demonstrate that. There we have a light source. We have two red boxes representing the crowns of two adjacent teeth and a screen on which the image is cast. The rays are being directed through the interproximal space. The central ray is parallel to the proximal surface. So the images are separate. Now as I change the direction of the rays, directing the rays more toward my right, the images now have overlapped, one on top of the other. When I go the other way, the interproximal space opens, reaches its maximum width, diminishes, and once again overlapping results. So this is achieved by changing the horizontal angulation. The contact areas in this radiograph are all overlapped. Now between the bicuspids we have the typical shape of overlapping. It is more or less pointed at top and bottom and widest in the center. Now between the bicuspid and the molar, the space is not quite as typical, and then between the molars it is rather atypical indeed. This is caused by directing the rays too far in a distal direction. Normally, teeth are frequently straight. Certain operations can be performed on them only because they're straight. If they're curved, then the operation can't be done. Now, if on a radiograph we artificially introduce the curve, then perhaps the dentist might think he could not do this particular operation. So it's well if we make our pictures with the roots nice and straight. Now I'll show you how we can make them curved. The screen is parallel to this nice straight yardstick, and I've already drawn the outline of the shadow, giving us that line. Now I'm going to change the screen to a location over here, and we're having trouble getting the film in the mouth. And so we're going to roll a corner of the film. All right, sir, now trace the outline of the shadow. Remember, this is the outline of a nice straight yardstick. This root is nice and straight. Now we look at the results. When the film is flat and parallel to the straight yardstick, we got a nice straight line. And when the film was curved, then we artificially introduced a hook or a curve in the outline of this root. Now we'll show what this looks like on a radiograph. The radiograph of this lower bicuspid displays a straight root, but then down toward the end it very definitely hooks toward in an anterior direction, hooks mesially. The lateral has even more of a hook to it. In fact, all of the details here look like they were pulled down toward this corner. It's because this corner was simply curled under the patient's tongue and did not present a flat surface to receive the image of the tooth. So this is very definitely a distorted image. We have seen many forms of distortion, and these were caused by manipulating the source, the object, and the screen. For each one of these difficulties, we also pointed out how to overcome it. So if we collect from each one of these difficulties the measures for overcoming these troubles, we can arrive at an ideal relationship between the source, the object, and the screen. First, we'd like to have a flat screen. For when we use a flat screen, we have neither length nor width distortion nor curving distortion. Secondly, we should like to use a small stationary source. This would eliminate blurring of the images. Third, we should like to use a long source to object distance. This ensures good definition with minimum enlargement. Then next, we'd like to use a short object screen distance. This also would ensure good definition with minimum enlargement. It would be desirable also to have the plane of the film parallel to the object. This would eliminate length and width distortion. And lastly, we would like to have the central ray perpendicular to the plane of the film or the screen. In this way, we would have no anatomical distortion nor length or width distortion. This concludes our discussion of the second part of the production and properties of images.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.